Come in.
Hi, my name is Caitlin. I'm a nurse practitioner student from South University. How are you doing today?
Good, how are you?
Great. And what's your name?
Tori.
Well, nice to meet you, Tori. I'm going to go wash my hands and perform a full head-to-toe assessment if that's okay with you.
Okay.
Okay. Tori is a very well-groomed young lady, dressed very nicely. No odors or anything noted. Before she came in, she performed her vital signs, her height, and her weight. She also performed the Snellen eye test, which she passed with 20/20 vision. She also performed the whispering test. I whispered words into her ear and she verbalized them back and she got them all correct. So I'm gonna go ahead and start. First I'm gonna assess your scalp, okay? I'm just gonna palpate and feel around. Your hair is soft, evenly distributed, no lumps, bumps, bruises noted, no flaking. Great, everything is symmetrical and midline. I'm gonna go ahead and have you squeeze your eyes real tight. Raise against my fingers. Open your eyes. Go ahead and wrinkle your forehead. Great. Smile for me and puff out your cheeks. Okay, great. I'm gonna go ahead and take a look into your eyes with the ophthalmoscope. You're gonna have a bright light come into your eyes. It'll just be real quick, okay?
Mm-hmm.
Your pupils are round, brisk, and reactive. Your sclera is white. I'm just gonna pull down on your eyes a little bit. Your conjunctiva is pink. Your irises are a nice hazel green. I'm gonna go ahead and I'm gonna have you look at me. I'm gonna wiggle my finger and I want you to tell me when you see it, okay?
I see it. I see it.
Okay, go ahead and cover one eye. Tell me how many fingers I'm holding up.
1, 2, 2,
And your other eye?
1, 1, 1.
Okay, I want you to look at me and I want you to follow my finger with your eyes, okay? Perfect. And when I looked in your eyes, I also noted your red light reflex. I am going to go ahead and look at your nose, which is symmetrical and midline. I'm gonna look up there with a light as well. Your septum is midline. There's no exudate or drainage noted. And your nares are patent. I'm gonna go ahead and look at your mouth. I would be performing this with gloves on and with a tongue depressor. So go ahead and stick out your tongue and say, ah. Great. Your uvula rises. Your soft palate is pink, moist, and intact. Your oral mucosa is pink, moist, and intact. The tongue is midline, and your teeth are in good condition. I'm going to have you close your eyes, and I want you to tell me if the sensation is sharp or dull, okay?
Mm-hmm. Sharp. Dull. Dull. Dull.
Okay, great. I'm going to go ahead and assess your ears. I'm going to palpate. No lumps, bumps, bruises noted. I'm going to go ahead and look into your ears with an otoscope. Great. Your ears are noted to be midline. There was a pearly gray tympanic membrane noted with a light reflex. Your bony prominences were noted, no exudate or drainage. I am going to go ahead and palpate your neck. I'm going to be feeling for all of your sinuses. My apologies, your lymph nodes, your clavicular, your preauricle, postauricle, your occipital, your submandible, your tonsillar, your superficial cervical, your posterior cervical, and your supraclavicular, okay?
Mm-hmm.
Just tell me if you feel any tenderness, pain, anywhere that I'm pushing.
No.
No pain or tenderness?
Mm-mm.
Okay, no swelling noted. Also no lumps, bumps, bruises noted. Her neck is midline, her trachea is midline. I'm gonna go ahead and assess your thyroid, okay?
Mm-hmm.
I want you to swallow. Perfect. Any difficulties with swallowing?
No.
Okay, great. I'm gonna go ahead and I'm gonna put my hands on your shoulders and I'm gonna put some weight and I want you to push. Beautiful, your strength is strong. I would like you to turn to your side and I'm gonna assess your back, okay? Your shoulders are midline and symmetrical. palpating for tactile fremitus. I'm going to go ahead and palpate for CBA tenderness. I'm going to go ahead and notice that your spine is midline, no deformities noted. I'm going to go ahead and auscultate your lung sounds. Every time that you feel my stethoscope, I would just like you to take a deep breath, okay?
Okay.
Beautiful. I'm going to have you turn to your front. Thank you. I am going to go ahead and just look and feel and palpate your extremities. I want you to tell me if there's any joint swelling or tenderness.
Mhm.
No tenderness noted. Okay. I'm going to have you do exactly what I do. I want you to put your arms out, arm up and down, up and down. I want you to push against my hands. Great. Okay. I want you to take your wrists down, up, push down. Okay. And hold your fingers out, squeeze in, and then hold your fingers in, squeeze out. Squeeze my two fingers as hard as you can. Your strength is noted to be equal and bilateral and strong. Your extremities have no swelling or joint tenderness. I'm going to go ahead and listen to your heart sounds, your apical, your pulmonic, your tricuspid, your mitral. I'm just going to reach down your shirt just a little bit. No clicking, rubs, or murmurs noted. S1 and S2 are present, no S3 or S4. Okay, I am going to have you lay down if you don't mind. I'm just going to move these out of the way. I'm going to go ahead, God bless you.
Sorry.
I'm going to go ahead and palpate your brachial and radial pulses. They're strong and equal bilaterally. I'm going to go ahead and palpate your carotid pulses as well. I'm going to go ahead and auscultate them. I'm going to have you take a deep breath and just hold it for a couple seconds. Okay, and you can breathe, and then we're going to do it again. Okay. I'm just going to inspect her abdomen, which is round, non-distended. No hernias noted, no stray, no scars, and no abnormalities or deformities noted. I'm going to, her skin on her legs are nice, warm, dry, and intact as well. She has no edema noted. I'm going to go ahead and auscultate your bowel sounds. I'm also going to go ahead and listen to your arteries. I'm going to go ahead and percuss all 4 sections. I'm going to go ahead and palpate your abdomen. I'm gonna feel for your spleen, your liver, your bladder. Tell me if you have any tenderness, swelling, any problems with me pushing. No hepatomegaly or splenomegaly or tenderness noted. Go ahead and test your range of motion in your legs. Can you lift your right leg up and down and out and in? Your left, you're gonna go up and down and out and in. I'm gonna go ahead and have pressure on your hips and assess your iliac bones, which are symmetrical in midline. Go ahead and move your right leg out and in, and then your left. Any pain, tenderness?
No.
Okay, no joint pain noted. Okay, I am gonna go ahead and palpate your popliteal pulses. I'm gonna palpate your posterior tibial. And I would, but for the purposes of this video, I would have her shoes off and I would palpate her pedal pulses as well. Checking her feet for any discoloration or edema. Okay, I'm going to also, while I'm on your feet, I would have your shoes off and test for your Babinski reflex. I'm going to have you sit up for me. I'm going to hold 2 objects in my hand, and I would like you to close your eyes and tell me what they are, okay?
Okay.
You can hold them.
Marker.
Very good. And one more.
A pen.
Very good. Okay, I'm also gonna, on your legs, I'm gonna have you close your eyes and I'm gonna do the sharp and dull again, okay? Tell me if it's sharp or if it's dull.
Dull. Sharp. Dull. Sharp.
Okay, great. And I'm going to go ahead and check your reflexes. Okay, great. Reflexes are present. Do you have any questions or any concerns at this time?
No.
Okay, I'm gonna go wash my hands one more time, and it was great to meet you, okay?